Welcome to the Ultimate CNA Exam Quiz, designed to help you sharpen your skills and boost your confidence as you prepare for one of the most rewarding roles in healthcare. Are you ready to test your knowledge of patient care, medical procedures, and critical CNA responsibilities? This quiz isn't just about answering questions, it's about learning, growing, and getting one step closer to achieving your goal of becoming a certified nursing assistant. Whether you're gearing up for the exam or brushing up on your skills, this is the perfect way to challenge yourself and have fun along the way. Grab a notebook, get ready to think on your feet, and let's dive into this exciting CNA quiz. Don't forget to subscribe for more engaging content to support your healthcare journey.
Certified nursing assistants CNA letters play a vital role in healthcare, and preparing for the CNA exam requires a solid understanding of patient care principles. Below are 20 questions and answers to help you practice for the exam. What is the primary purpose of turning and repositioning bedridden patients every 2 hours? The answer is to prevent pressure ulcers, improve circulation, and promote comfort. How should you assist a patient who is experiencing dysphagia? Provide small bites. Allow plenty of time for swallowing. And ensure the patient is in an upright position. What is the normal range for an adult's pulse rate? The normal range is 60 to 100 beats per minute. How should you respond if a patient begins to fall while you are assisting them to walk? Gently guide the patient to the ground while protecting their head to prevent injury. What is the best way to prevent the spread of infection in a healthcare setting? Proper hand hygiene, including washing hands thoroughly and using hand sanitizer, is the most effective measure. What should you do if a patient refuses a bath? Respect the patient's wishes, report the refusal to the nurse, and attempt to understand their concerns. How do you measure a patient's blood pressure using a manual cuff? Place the cuff on the patient's arm, position the stethoscope over the brachial artery, and inflate the cuff while listening for the first and last carot cough sounds to determine systolic and diastolic pressure. What is the term for the legal document that outlines a patient's healthcare wishes? This is called an advance directive. How do you provide oral care for an unconscious patient? Use a padded tongue blade to gently open the mouth and clean the teeth and gums with a soft toothbrush or foam swab, being careful to prevent aspiration. What should you do if a patient complains of chest pain? Report it immediately to the nurse or supervising medical staff, as this could indicate a medical emergency. How do you assist a patient who needs help eating? Encourage independence by allowing them to do as much as possible and provide assistance as needed, ensuring safety and dignity throughout the process. What is the first step when providing perineal care to a patient? Always explain the procedure to the patient and ensure privacy before beginning. How do you properly lift an object to avoid injury? Bend at the knees, keep your back straight, and use the strength of your legs to lift. What is the first action to take when finding a patient unresponsive? Call for help and check the patient's breathing and pulse. How do you calculate a patient's intake and output? Measure and record all fluids the patient consumes and excretes, including oral, intravenous, and urinary output. What is the term for a device used to help a patient ambulate? A gait belt is commonly used to provide support and stability during walking. How should you respond if a patient is experiencing a seizure? Protect the patient from injury by removing nearby objects, ensure their airway remains open, and never place anything in their mouth. What is the role of a CNA during a fire emergency? Follow the RAISE acronym, rescue patients in immediate danger, activate the alarm, contain the fire by closing doors, and evacuate if necessary. How do you provide care for a patient with a urinary catheter? Ensure the tubing is free from kinks, keep the drainage bag below the level of the bladder, and maintain proper hygiene. What is the most important aspect of caring for a patient with dementia? Providing a calm and structured environment while maintaining patience and understanding their unique needs. What should you do if a patient complains of pain during a procedure? Stop the procedure. Report the pain to the nurse, and document the patient's complaint. How do you assist a patient with limited mobility to prevent blood clots? Encourage range of motion exercises and reposition the patient frequently to promote circulation. What is the proper way to dispose of soiled linens? Place them in a designated laundry bag without shaking them to prevent the spread of pathogens. How do you ensure the safety of a patient using a wheelchair? Always lock the wheels when transferring the patient and ensure their feet are on the footrests. What is the CNA's responsibility in maintaining patient confidentiality? Follow HIPAA guidelines by keeping all patient information private and sharing it only with authorized personnel.